Hello, thank you for tuning in today for advocating for your child with epilepsy. We are excited we are joined by Shannon Waid of the Epilepsy Foundation of Michigan. She is their education and outreach specialist. If you are just hearing about Michigan Alliance for Families, if this is your first video viewing, if you're just poking around the website, please know that Michigan Alliance for Families is your guide to all things special education here in Michigan. We are totally free parent training and information. Um, we help families understand all sorts of different aspects of special education here in Michigan, better understand our federal law, our Michigan rules, all of those pieces. Our regional parent mentors live around the state in the areas that they serve. So they know their local communities, they're able to help you find information, resources, and answer your questions. So know that we are here to support you. If you have additional questions after viewing this video, go ahead, give us a call, 800-552-4821, or poke around for some more information on the website. Super excited to introduce Shannon. Shannon, you want to go ahead and take us through advocating for your child with epilepsy today? Thank you for joining us.
Thank you so much for joining us today for advocating with your child with epilepsy. It's a pleasure to be here with you today. My name is Shannon Waid. I'm the Education and Outreach Specialist here at the Epilepsy Foundation of Michigan. What makes this especially important to me, this conversation, is that I too have a daughter with epilepsy. My daughter, you'll see some photos there on the bottom. She was diagnosed at 11 weeks old. So this work is very, it's passion, right? It's passion and it's care and it's advocating, because we know that school can be challenging enough without an epilepsy diagnosis and the things that go along with having epilepsy. Part of our journey has been long. She is now 17 years old. She's actually currently right now seizure free, but she has a service dog. He's an epilepsy alert dog, and that's been part of our journey. And now my daughter is learning to be her own advocate. So she's been doing a lot of work with me in the foundation, which is really exciting. So I am so glad to be here with you guys today. First and foremost, the mission of the foundation. I just want you to know that this is a place for you. If you have not connected with us, we are here to support you in every phase of the journey of epilepsy. We know it's not just having a seizure. There's many things that go along with that, whether it's school and IEP resources or education within the schools. Whether that's once they transition out of elementary, junior high, and high school, right? That transition piece, it can be really important. The mission of the foundation, though, is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies, stop seizures, and find cures. The purpose of today's training is to provide a better understanding of epilepsy and how to effectively support students with seizures by doing a few things. First and foremost, creating a safe and supportive school environment, supporting positive outcomes, advocating for a student with seizures, and understanding mental health and emotional issues. So first, we're going to start off by watching a video. This is going to be a video that takes place in a school setting. It's really the ideal situation. We know, if we've had any experiences with seizures taking place in school, that this is not always what happens, but this is what we would like to see happen. So go ahead and take a peek at this.
Guys, give us some room. He's having a seizure.
Get me some towels.
Okay. Stay calm. It's gonna be fine. Help me get him on his side. All right, listen up, fellas. Before we practice, I want to go over a couple of things. First, I'd like to welcome back Michael. Huh? Good to have you back. We all know Michael has epilepsy, and he shared his seizure with us in the game. He has something he wants to say.
Yeah, thank you all for supporting me, and thanks to Coach for knowing what to do. I'm sorry if my seizure scared you guys. It could be scary for me too. But what's even more scary is if people didn't know what to do.
So today, we are going to learn seizure first aid thanks to the Epilepsy Foundation. We're teammates, right? We take care of one another, we count on one another, and when anyone with epilepsy has a seizure in front of you, they're your teammate, and they're counting on you. So, first, stay with him, okay? Stay calm and keep others around you calm and out of the way. Protect him, keep him safe. It's also important to remember that the person having the seizure should be lying down and that there is nothing harmful in their way. Turn them on their side and support their head so that they're not banging it and so they don't choke. Never put anything in their mouths and do not hold them down. Time the seizure till the very end, okay? Knowing how long the seizure lasts is important information for the doctors to know. If the seizure lasts more than 5 minutes, call 911. When you see somebody having a seizure, you're going to feel a little powerless. But if you protect them, and if you stick with them by their side, you're doing the right thing. Okay? All right, let's practice this.
Bulldogs on 3. 1, 2, 3.
Bulldogs!
So as you can see, that is definitely the ideal situation, right? We know that that can look different and depending on your student specifically, what their needs are, what their challenges are, what their epilepsy might look like, what their seizures might look like. We know that that really is dependent on where the location is that this takes place and who properly has the information that they need to care for your student. We're going to talk a lot about that today. So before we do that though, let's go ahead and just talk about epilepsy and seizures, what that is, the brain. Most of you who are joining us today probably already have a good knowledge base of what this is, but we're going to talk about it briefly and then we'll move on to how can we support our students. So the brain and seizures, right? The human brain is made up of billions of nerve cells, and those cells are called neurons. These nerve cells communicate with one another by sending and receiving electrical impulses. Normally, these electrical impulses, they're carefully coordinated. However, sometimes there's a temporary change in the disruption of the way the brain sends those electrical signals, almost like a short circuit. In the way those messages are sent, different things in the body can occur. You might also hear those referred to as storms in the brain, short circuits, episodes, a seizure. There's many different things to recognize with that. It's important to know that any person has the capability of having a seizure, but not everyone who has a seizure actually develops epilepsy. Some seizures can be provoked by other medical conditions or situations. So for example, if a person has a sudden drop or spike in their blood sugar or develops a high fever or infection or brain injury, seizures could happen associated with those acute events. So we're going to go ahead and move forward on that. What do seizures look like? It really depends on where the seizure takes place in the brain, right? We know there's a really wide variation when it comes to the epilepsy spectrum. Many of these different types of seizures can look and feel very different. Most often though, when we think about the word seizure or epilepsy, we think of the typical person falling to the ground, collapsing, not aware of their surroundings, their body's shaking. And that is an image of a specific type of epilepsy or specific seizure. However, that's not the most common, but that is what media portrays, right? So it's important to know that seizures can result in a lot of changes, whether that's movement, sensation, different feelings within the body, behavioral, sometimes it looks like a behavioral situation when it actually it's the body, the brain misfiring. Speech can be affected as well as awareness. A person may or may not be aware during a seizure. It's important to know that these symptoms and signs of seizures really can vary from person to person, but they are usually consistent and predictable for each individual. And I like to point that out for each individual. When we do our seizure first aid training for school staff, we talk about what that looks like. So if a student has a specific type of epilepsy, most likely, not always, their seizures are going to look the same. Now, when we might consider that a medical emergency is if there's suddenly a new change in the seizure type. So what is epilepsy? Epilepsy is a chronic brain disease characterized by two things: reoccurrent and unprovoked seizures. So reoccurrent meaning the seizure happens more than once. They have one or two seizures, and then there's a reason to believe that they're going to have more. Unprovoked means that the seizure is not provoked by an acute illness, kind of the things that we talked about before, a fever, a head trauma, that type of thing. Epilepsy is sometimes referred to as a seizure disorder. We do a lot of conversation. I think this is a good time to bring this up. For my personal example, I can share with you that my epileptologist, a pediatric epileptologist, never shared with my daughter that she actually was having a seizure. They used other words for that. Sometimes that might be, a storm in the brain. It could be an episode. It's really important and valuable information to not only pass on to educators and those caring for your students, but also the student. Let them know that the word epilepsy is not scary. The word seizure is not scary. It's better to call it what it is than have some sort of miscommunication or misinformation out there. Because as you can imagine, if you receive a phone call from the school saying your daughter's having an episode, what that means could vary, right? And when we think episode, quite often, not as a parent of a person with epilepsy, we think of behavioral or something like that. When in reality, if it's a seizure, we need to know that it is a seizure. Now, who can have epilepsy? You probably already know this. Anyone, anywhere can have epilepsy. It's not something that discriminates at all. It occurs in different ages, though we do often see it in those younger than 15, most commonly diagnosed, as well as those older than 55 years old. Numbers are intriguing to me. I think these numbers really state some needs within the state of Michigan and beyond. Nearly 14,000 students in Michigan have epilepsy. The United States alone, there are 3.4 million people with active epilepsy. So that refers to people who have been diagnosed and have been started on treatment. Almost 500,000 of these people are 17 years old or younger. So that's really the people that schools come in contact with the most, right? If we think about our average classroom size being less than 30 students, 1 in all of those students will be diagnosed with epilepsy at some point in their lifetime. That's a big number. And there's a reason that we need to bring education to the forefront of conversation. At least 1 in 3 people will be diagnosed. They'll have uncontrolled epilepsy, so meaning that their current treatment is not working to control their seizures. And if a student falls into this category, planning could be a little bit more difficult. They might have additional school needs. There might be extra testing and appointments and miss school. A lot of things to consider. As we discussed, 1 in 26 people would be diagnosed with epilepsy in their lifetime. And that's the reason we push for seizure education in all schools. Even more commonly, though, is how many people will have a seizure in their lifetime. 1 in 10 people worldwide will have a seizure in their lifetime. So the reason for understanding what epilepsy is, breaking down the stigma and the stereotype behind it, and pushing for seizure education throughout the nation. There's definitely some fears and risks related to seizures. Different things, can be caused or dreads can be feared. That could be for the educator, that could be for the parent, that could be for the student. So things to think about, risks for injury during a seizure. If a student falls or trips or that type of thing, there could be physical injury involved. Sometimes difficulty breathing during a seizure. Of course, drowning is something we often think about. Families living with a person with epilepsy, we think about whether it be a pool or a shower or a bathtub. We know that is a very big reality, and we need to take steps to avoid that type of situation. Prolonged seizure activity. This is one of the things that we most worry about. Status epilepticus is what it's called. And that's where the body doesn't come out of that seizure quickly or quickly enough, and additional assistance is needed. And that would be another seizure emergency. Other things to consider are early deaths, whether that's by accident or drowning, breathing or heart problems. There's also something called SUDEP. And if you're not aware of what SUDEP is, please reach out to us. We'd be happy to bring some education to you. SUDEP is sudden unexplained death in epilepsy. A lot of our students actually do know what this is. Just a few years ago, a Disney star, Cameron Boyce, passed away from SUDEP. And that's usually when a seizure occurs kind of out of nowhere and there's a death in epilepsy. And then another thing to consider is the risk of depression, suicide, that type of thing, because any type of neurological difference or change could have increased needs. The prevalence of learning problems. Let's just take a peek at this. 50% of children with epilepsy have school-related difficulties. That's a big number, 50% of children with epilepsy. 25% of children with epilepsy have learning disabilities. So maybe there's other needs when you consider that IEP or 504. The risk of learning problems are 3 times higher than the general population. Again, that's why it's something that we probably don't want to hide or not share with the school. We need to have them active and involved. Even if the student doesn't want to share their story, the school needs to be informed, because there could be other things to offer the student with resources to learning, that type of thing. Currently, the Epilepsy Foundation of Michigan is doing a needs assessment test, or survey rather. I can't wait to get those numbers back, because I'm sure these numbers have changed. Our survey that I have here posted is a little bit older, but 64% of children with epilepsy have reported experienced school performance problems related to their epilepsy. That's a big number. And a lot of times it's going to be things like memory, cognition, understanding, that type of thing. Really, the spectrum of impact for epilepsy really can range from frequent seizures to intellectual disabilities to full seizure control or no cognitive impact at all. Most children with epilepsy fall in the normal range of an IQ, but more have sources in the low normal range than the general population. Cognitive difficulties may be subtle or even transient and therefore not be easily recognized. Sometimes even, which might be part of your story, we don't even know that a student is having a seizure until it's actually been diagnosed. And many times we see students going many years without a proper diagnosis of epilepsy. So again, just good conversation, good education to get out into the public that there could be missed things that we're looking at. Even benign forms of epilepsy, so those are going to be childhood absence, different things like that, are associated with learning problems. So this includes after the child's actually outgrown their epilepsy. So another thing to consider. So next we're going to talk about different types of seizures. There's 3 different types of seizures, the 3 main groups actually. We have focal onset seizures. That really means that the seizure begins in one area of the brain. They might stay in that area of the brain, or they could spread out into larger areas of the brain, sometimes including both sides of the brain. We also have generalized onset seizures. So in this type of seizure, the activity usually starts in the middle or deep areas of the brain and then spreads out to both sides at once. You can see that here on the graph a little bit. And then we have unknown. Unknown is the tricky part too. Actually, all epilepsy's diagnosis can be tricky, but unknown is a little bit frustrating for families. I can specifically share that because I am that person, that family member who was frustrated because we could not get answers. We didn't know what was happening. EEGs were not telling us things. Testing was not telling us things. Recording of what the seizure looked like was not telling us things, and it took many years for a proper diagnosis. So basically, unknown or unknown onset means that we don't have enough information. We don't know where the seizure is actually starting in the brain. Sometimes that's because that's not a witness seizure. Maybe a student has tonic-clonic, or not tonic-clonic, has nocturnal seizures happening at nighttime, so they're not witnessed. For adults, maybe the person lives alone, so a seizure hasn't been witnessed. Or maybe the person didn't even recognize that that was a seizure. It's important to know that there are about 40 different types of seizures that fall into these three classifications. It's important to know that just because somebody might be aware of what a tonic-clonic seizure looks like, other seizures really do differ person to person. Remember, affecting their movement, sensation, behavior, speech, and awareness. Another thing that I want to share a little bit about, which is a conversation that's not happening nearly enough, is if your student has PNES or functional seizures. They go under two different names. Functional seizures is the most common. The other is psychogenic non-epileptic seizures. Additional steps for education may be needed. This is a very sensitive topic that's really not well understood, and that's even by medical professionals. So don't be alarmed if schools don't understand, because even medical professionals have a very difficult time understanding this diagnosis, but it is a very real diagnosis. It's also possible for a student to have both epileptic and non-epileptic seizures. So for functional seizures or psychogenic non-epileptic seizures, or PNES, these behaviors really resemble seizures. Epileptic seizures are caused by a sudden abnormal electrical discharge in the brain. Epileptic seizures also have characterized EEG changes during the seizure. The EEG shows no electrical disturbance associated with this type of event during a psychogenic non-epileptic seizure or functional seizure. Those are really the two big differences. However, I will note this just for those parents who say, well, we're not seeing changes on an EEG. That doesn't come to a conclusive diagnosis. So please ask all the questions. It's important to know that PNES is caused by stress or psychological experiences, or sometimes even emotional traumas. Sometimes things that we don't even think about that were emotional traumas, right? Maybe there was an injury at birth or a death in the family. Different things like that can certainly be a cause of PNES or functional seizures. So school education and impact of learning. We're going to talk more about contributing factors to learning and different triggers. While every student goes through transitions as they age and enter adolescence over the course of their education, there are a number of significant changes that take place for students living with epilepsy, and I think we could all agree on that. This can include changes in seizure patterns, treatments, strategies, social and emotional effects, medication side effects, which is very, very common, depression, mental health concerns, and responsibilities for self-management. That's another big one that we hear from parents quite often. So it's important to note that the impact of epilepsy goes far beyond the seizure. And when families and schools recognize the signs and understand the root causes of some of these challenges and changes, we can better equip our students to feel seen, included, and have better success. We're going to talk briefly over this page here. As we've discussed, the impact of seizures can be great, right? Considering different triggers in the school setting and at home is something that could be considered as an additional school accommodation request. So I'm going to bring these up quickly, but just know that sometimes we have to be clever when we're asking for school accommodations, but I'll mention a few of those. So as we know, mismedication, lack of sleep, and stress, those are the three biggest triggers, right? Mismedication, it could certainly have a breakthrough seizure because of that. Lack of sleep, a breakthrough seizure could happen. Stress, this is part of life, right? It's unavoidable. Stress can be both positive and negative. So you think of your student who is getting ready to either take a big exam or has a celebration at school, or maybe they're in a play at school or a basketball game. Those can all be either positive or negative stressors. So something to consider is to adapt that environment a little bit, right? Make sure sleep hygiene is taken into account, making sure medications are, whether that's you set up reminders or that type of thing, because those three things can help your students succeed with their epilepsy treatment and care. Now, I mentioned these things, but this is also something that I would encourage you to, if you know your students' triggers, to make sure that that's communicated with the school. I know for many families, I work with families all the time, sometimes they just don't know. They don't know what those triggers are. And sometimes just by recording and logging what happens before, during, and after a seizure, even a day before and after, sometimes that gives them some insight as to why it's happening, what's that trigger happening. Additional triggers to be thoughtful of: alcohol and recreational drugs certainly can assess to a seizure. Hormones. The brain contains all of these nerve cells, right? And it affects our estrogen and progesterone, which are our main sex hormones for women. So during the menstrual cycle, during a specific period of the month, you may see an increase of seizure activity or even a decrease in seizure threshold with their medications. Sensitivity to light is another one that you quite often hear, right? It kind of goes with somebody falling to the ground having a tonic-clonic seizure. It's important to note that only about 3% of people with epilepsy actually have an exposure to flashing lights at a certain intensity at certain visual patterns that can actually trigger a seizure. Now, that doesn't mean that they can't be sensitive to light. They can't be sensitive to patterned or that type of flashing lights. They could certainly be sensitive to it, which could cause maybe a migraine or something else and then lead to epilepsy. But only 3% of people actually have an exposure, a sensitivity to the exposure of flashing lights at certain intensities or those patterns. So if you have a student with that, this type of sensitivity, please reach out to us. There are some things that we'd be happy to offer the school, some assistance and some ideas that we can creatively approach the IEP and the 504. We'd be happy to do so. Other illnesses to think about: head colds, lung infections, sinus issues, all of these types of things. And on top of that, what medications you're giving your student or the person's taking to treat those issues. Those over-the-counter medications can certainly lead to play a pivotal role and decrease the threshold for seizures. There's also nutritional deficiencies. Some students are on ketogenic diet or a modified Atkins diet. If you have a student with one of these diets or deficiencies, again, feel free to reach out to us. We do trainings. I just recently did one on a student who's very, very strict ketogenic diet. Really, the only thing he takes by mouth is oils and fats. And he needs a little assistance during the day and at school. Number one, to make sure he's not putting out anything else in his mouth, such as treats because it's somebody's birthday or it's a holiday party. But he also needs encouragement from an aide to make sure he completes his lunch, to make sure that nutrition goes to his body and helps, possibly abort a seizure. Other contributing factors to learning, let's talk about a few of those. So is there an underlying brain condition or injury? Maybe that happened at birth. Maybe that happened later in life. Maybe the student was born with one of these injuries. Are there medication side effects? Kind of we talked about it before. What is the effect before, during, and after the seizure? We need to think about that when we're planning with the school, right? Does my student need a rest period after a seizure? If so, what does that look like? Who's going to be with them? Another thing to focus on is brain injuries from status epilepticus or prolonged seizures. This is what every parent tries to avoid by getting the proper treatment and seizure first aid, so that way a student is not in prolonged status epilepticus. Absenteeism is very common. We see numbers very high in students with epilepsy for many reasons. Maybe they had a seizure at night and it is kind of taking them out for part of the day and they have to come to school later in the day. Maybe it's because they have testing or EEGs that they need to be inpatient in the hospital for. A lot of different things to consider, as well as poor sleep. So we talk about sleep hygiene quite a bit, especially in those junior high and high school students where they kind of are getting a little more independent. We talk about what that means to get good sleep, not just being on your phone, scrolling, that type of thing, because that's very important. Next, we're going to talk about some contributing factors. These are all the things we kind of touched on. I'll just briefly go through these. So what are some of those underlying conditions? That could be cerebral palsy, autism, intellectual disability, maybe a traumatic brain injury. Maybe those are the primary causes of learning difficulties. So something to consider. However, not to be automatically attributed to all learning problems of the primary diagnosis. We know that epilepsy is very real and very significant. It sneaks its head up whenever it wants to. It's so unpredictable. So a lot of things to consider there. We talked about those medication side effects just a little bit, right? There are different therapies as well that can cause cognitive and behavior side effects. One of the most common things we've seen, and I think I shared this, we have students reporting back to us that they have memory issues, sometimes depression. So there might be a need for other assistance, whether that bringing in the school counselor, bringing in somebody who's going to help relearn work after a seizure. Sometimes that means just having a journal that all assignments go in, where the student can take that home to the family and they can have conversation about that in the evening. So many things to contribute, and different factors to consider. Again, medication side effects, we know those come at all different levels, all different shapes and sizes. Impaired attention, drowsiness, slow processing speeds, coordination problems. I know many, especially younger students, have those coordination problems. Sometimes even a student might be hyperactive, or maybe the opposite, right? Because of a medication. And then there's also mood changes, whether that be irritability, depression, anxiety, those types of things. So just always something to consider, what else is going on, what that whole picture looks like, other than just the epilepsy diagnosis. We talked a little bit about what happens before, during, and after a seizure, right? Sometimes before a seizure, a student will have a headache, might have some irritability, or maybe even high anxiety and become distracted easily. During that seizure specifically, there's going to be misinformation. They might be, distracted. Maybe that's not even reported to a classmate or an educator. So those are things to consider. Confusion and sleepiness is very common after a seizure. Depression, muscle soreness, headache, weakness, paralysis, blindness, loss of sensation, sometimes even loss of speech is definitely something that could take place after a seizure. And remember, these symptoms vary really person to person, some of them lasting only a few seconds to a few minutes to up to a day or two, and maybe even beyond. Teachers may assume that the student's back to normal, but really there's still some post-ictal symptoms that might persist. We talked about that being absent, right? So definitely a conversation to have, something to consider when planning the IEP in 504, just that there may be times that the student's going to be out of school. If so, what can we do to support the student from afar? There may be times that the student can't do extra work or do things at home, but there might be times that they can. Poor sleep, we talked about that too, just making sure that sleep can be a trigger, and we want to avoid that and get good sleep. So how can we improve our performance at school for our students? First and foremost, I always like to talk about this. If you don't know what a seizure action plan is, you need to. A seizure action plan or a response plan is a document that you can collect a lot of information about your child or your youth in one place. If you're joining us today, I wonder if your student has a seizure action plan and if it's up to date. If not, I would suggest you reach out to your medical team and request it. A seizure action plan should also be included in the student's IEP or 504 or health plan, and all staff, that's the key word, all staff working with your student should have knowledge and have easy access to this plan. This includes support staff, so bus drivers, lunch aides, office staff, coaches, after school events, anybody who's running those. Everybody should have access to this plan at some point, and they should also be able to go back to it and reference it. We actually like to say every month or two to reference it, because it could be easily missed or forgotten. So on this form, you can see some of the things that are collected. Every form is a little bit different. This is our foundation's form. Our national organization has put this out. I love everything on this form except for one thing. I would like to see it include a photo of the student, because if you have substitutes, that type of thing, I think that's also important. But I will tell you that if you go to a different health system, sometimes those seizure action plans look a lot different. So if schools are collecting different seizure action plans or medical plans from different students and they all look different, it sometimes can be a little bit tricky to read. It's not very precise. A quick glance tells you what to do. So we really love our plans. There's several, actually all of the pediatric epilepsy centers in Michigan do have access to this plan. You can certainly also bring this plan into your physician's offices and ask them to complete it with you. It's definitely a plan that is completed by both the parent and the physician. So this is a medical document as well. And it's important that there's some key facts on there. And this is where sometimes you might not see this on a general plan from a healthcare system. So a few things to make sure are on your plan, regardless of the plan that you use. You want to know what steps to seizure first aid. You want to know any specific instructions for that student, when the seizure becomes emergency and what to do. Does the student have a rescue therapy? If so, when do we give it? How do we give it? How much do we give? What is the protocol there? And who do I call? When do I call? Do I call EMS? Do I call parents? Do I not call anybody because the seizure lasted 1 minute? There's different practices for every student. So that's super important to note. The other thing I like about this is it also, on the flip side of this form, it also talks about what are those triggers. This is important information for educating and leadership in the schools. What are triggers? Are there any other allergies? Is there anything else I should know? And also, what does a seizure look like typically, right? This paints a clear picture of what could possibly happen. So again, if you do not have a seizure action plan, I encourage you to take steps to get one. You can always reach out to the foundation. Your physicians or epileptologists, neurologists should be able to assist with that as well. But this is a medical document and should be included in the IEP 504 or health plan. So let's talk about advocating and tailoring care for your students. It's really going to depend, right, on the school situation, what safety they have, safety protocols they have in place, what accommodations the school's considering. So seizure type, depending on how long the seizure type lasts and what happens, really depends on what kind of rest period's needed. So that's going to be something to consider. Seating in the classroom, or seating in the classroom in general, maybe somebody needs help focusing. So we might need to place them differently in the classroom. Something else to think about is settings. Say you're either on the playground or your school is multi-level and there's stairs. If a student has a seizure close to stairs or a parking lot, for instance, what is the process going to be? Who's going to be available to help? Is there an adult available to help at all times? Sometimes that means a buddy system. Sometimes that means just making people extra aware and vigilant of keeping eyes on certain students just in case. So definitely something to consider. There's always that potential for injury though. Again, another resource you need to think about as you're sharing with the school is, I always recommend that seizure first aid training and recognition is a course that they take. This gives a 2-year certificate in seizure recognition and first aid. This is actually something we are working on with legislation to get a law passed actually in the state of Michigan, where it's called the Seizure Safe Schools Act, where all school staff must be seizure first aid certified. It's not in practice yet though, so that means we need your help in pushing that. I have definitely recommended multiple times to many people and families to have that written into their 504 or IEP, that all staff must be seizure first aid trained. Additional things to think about. Does your school have a nurse? If so, does the nurse know? Does she or he, what is their process of communication? Are they part of the IEP meetings? If you have a MERT team, are they comfortable? I can't tell you how many times I've talked to folks on MERT teams who say, I'm comfortable with everything but a seizure. So we just need to make sure people are comfortable and have the proper education and knowledge and know-how. So that means, again, coaches, aides, office staff. We need to make sure they're aware of that seizure action plan. And we also need to understand what school policy is. We do not need to be sending students home after a 1 or 2 minute seizure just because. Our goal is to keep students in the school, right? Our goal is to keep them there as long as they're safe and can actively learn. Now, that means they have to take a half an hour for a rest period out of their day. They can still go back. So we want to keep the student in their school setting as much as possible. So some common pitfalls. Educators may assume that school performance problems are due to lack of motivation. And we know that's simply not true. Sometimes a student has a normal IQ. Sometimes it's just because of the nature of epilepsy. Student performances may wax and wane. So if you have a student who is maybe trying out a new medication, you might see some behavior and cognitive changes. There's different things we need to take into account for. And so having open dialogue is going to be really important to say, listen, we're in the middle of trying to figure out the right medication, or we've made some recent changes. So just keep that conversation, because things could look a little bit different during that time. Transient impairment during assessment may lead to under or overstimulation of abilities. So making sure epilepsy related variables are noted and taken into account when interpreting results. So for example, if your student has a neuropsych testing done, newly diagnosed with epilepsy, still so many unknowns, it might look different in a year, right? Or it might be different once the student's on a medication that's properly managing their epilepsy. So just different things to understand, and common pitfalls that we sometimes miss just because we go back to Old Faithful, right? So if you have your yearly IEP meeting or 504 or whatever that looks like for you, good conversation to just make sure that these things are in place. Some additional evaluation and accommodation information, strategies for improving school performance. Request a medical management meeting, whether that be your 504 plan, because we know epilepsy is under the ADA civil right law. Request evaluation for different services, creation of IEP. Again, epilepsy falls under OHI, which can be significant learning disabilities such as TBI, emotional disruptions, intellectual disabilities, and multiple disabilities. Epilepsy falls under that as well. And sometimes we have systems in place where maybe they push for one or the other, a 504 or an IEP, but the parent really has the ability to do some education there. Michigan Alliance for Families would be a great resource for you, as well as the Epilepsy Foundation of Michigan. What is the best plan for the student specifically, and why is that? So let's think about those things. Test results show disabilities that are not significantly to impact learning. So build upon the accommodations, whether that's in your 504. Request that an independent neuropsych evaluation. Absolutely appropriate. This slide here, you can't really see a whole good picture of it. This is information that if you go back in all the other presentations, you'll be able to find this information. But it really looks at the differences between an IEP or a 504 plan, right? How long does it take before an IEP be put into place, or that type of thing? So really make sure you do the education around that. And I would suggest Michigan Alliance for Families to assist you with that. Conversation for improving school performance. So what are some of the needs? Does your student need a full or part-time aide? Do they have access to a resource room? Is there speech and language therapy available, or occupational therapy? Is there trainings to address specific learning disabilities? Are tutors available? Psychological counseling. Do you have a counselor who's ready and available? Not only do you have a counselor who's ready and available for the student, but if classmates or peers or educators experience somebody having a seizure for the first time, they also might need a conversation. They might need somebody to talk to kind of replay the situation and understand some of the things that go along with that. What are the efforts to raise awareness and reduce stigma in your student school? There's a lot of ideas that I have and that we've been doing throughout the state of Michigan, and they really are, they're powerful. They're powerful. And the younger you start, the more powerful I believe they are. What medical accommodations do you need? Is there a designation place for recovery period? Is somebody staying with the student after that recovery period? Different things like that. Sometimes that's going to be, testing materials, whether that's being read to somebody or photos are being shown instead of, auditory, that type of thing. So there's a lot to consider when looking at accommodations. Other things could include late start times or refocusing time, right? So those testing times, when we think about that, if we have a student who has nocturnal seizures and has difficulty first thing in the morning because they were up having seizures during the night, they're going to need a late start time, or they're going to need a time of refocusing and rest after a seizure takes place. Different stressors, timing of testing, or other stressors, including maybe overheating, overexertion, sensitivity to what all is going around them, the lights, the sound, overstimulation in general. There's going to be some mislearning, right? Is that because of impaired awareness? Maybe because of medicine side effects, memory, missed school, retention. It could be multiple things. So again, there's a lot to consider, but really being creative when we're talking about our accommodations is going to be really key factor to the success of your student. Some questions for school administration. So what services do you have available? Is there a school nurse? Is there a district nurse? If so, what are their responsibilities? How do I contact them? How many hours do they work? How often will they see my student, right? Same goes with OT, PT, counselors. Ask those questions. Is there a nurse designated to handle these issues if a seizure occurs? If not, who is the designated person, especially if there's a rescue medication that has to be given? What's the school's policy on medicine administration? Can teachers and auxiliary staff and bus drivers and coaches, can they administer these medications? Because per the doctor's request, they're asked to do that in the case a rescue medication is needed. A rescue medication is designed for a lay person to give, as long as they feel comfortable and safe doing that. For medication administration classes, is there anything suggested from your school? Is there access to monitoring post-seizure activity, right? That area where we can monitor that. Those are all things to consider. What are your attendance policies? What methods do you have to accommodate children's absences without a penalty? That's a big one. Homebound or hospitalized student accommodations and school staff responsibility for keeping that child up to their program, and how do I request it? So sometimes we have to plan ahead for those VEEGs or epilepsy surgeries or long-term or inpatient stays at an epilepsy monitoring unit. We need to think about those things and ask, how's the school going to accommodate that? What is suspension policies? Something to think about, because often epilepsy can be confused with other issues, right? It's not uncommon for a student who has a seizure that's where they're unaware, but they're still able to walk around and talk, but they don't make sense. Maybe they say things inappropriately or walk away from a teacher. These are all things that we need to talk about now, so that way, if this should get into place, we have the information we need. What is the school's bullying prevention methods? Investigation methods, counseling for those who are both the perpetrator and the victim? What are the things that are put in place now? Because we know that school can be hard, right? To add an epilepsy diagnosis on top of that, we need to make sure that this is a school that's a good fit for our student. They're going to care for our student well, not only in the case of emergency or epilepsy, but in their entire well-being, right? We need to think about how these things are going to affect them for long term as well. So in conclusion, students with epilepsy often need accommodations and special considerations, even if seizures are only subtle or transient. Understanding a diagnosis and available supports will help guide this conversation. Multiple factors to contribute to seizures. There's learning difficulties and many individualized needs. Communication is key, though. Families and staff are the key contributors to your students' success. So the more you can be involved, the more I would encourage you to be involved without being overbearing. let your student kind of run that conversation too. Bring them into the picture. It's so important that they're part of their own epilepsy journey. Of course, with younger students, it's going to be a little harder to do that, but you can bring them in. Celebrate things like Purple Day. Celebrate their differences and make it a normal thing. School support can be modifiable, right? School training is available to staff for seizure first aid and recognition, including those support staff people. It's important to include them. It's appropriate that you request that from staff to understand your students' specific needs at all levels. And it also gives insight to the 1 in 10 who could have a seizure in their lifetime, right? So this is not only protecting your student, but this is protecting the whole community. Other supports, we have lots of supports to offer. Michigan Alliance for Families is one of our partners, and we are so honored to work alongside of them. We have many families that we work with simultaneously and offer supports and programming. There's many, many different things that you could do to help guide a conversation and advocating for your student with epilepsy. So just know that we're here. So we're going to talk about a few more supports and services available. So first up, monitoring for changes in behavior and mood with early intervention requests with those IEPs, 504s, right? Social work, we've already talked about that. Disability manifestation determination, review to prevent unfair discipline and suspension. We need to think about those things. Again, Michigan Alliance for Families has some great training videos that you can access on their website. Is there a need for a parapro? If so, how do we request one? What is the change in placement or the hope for school accommodations with those that we're serving, our students, as well as the school's needs? Constant contact. Teachers and school staff change so quite often, right? Whether it's a substitute in the room or somebody filling a placeholder. So it's going to be really important for every student's information, medical information, to be shared with the appropriate people to make sure that the information is safe and secure and protected, but also so they can understand what is the student going to possibly experience in my classroom, right? We want to know, is there a seizure activity? If so, when did that happen in the day? How long was it for? Did you see any behavioral changes? These are all things that we can ask from support services. When we think about mental health, developing a working collaboration relationship is really important. Some students can just talk, right? Convey a very caring attitude, avoid negative techniques such as punishment, sarcasm, critique, criticism, and really increase that positive learning environment. Again, we've talked about some of these, increasing the need for test time or assignments, that type of thing. Sometimes it's just pairing a student up with another student in the class so they can kind of go back and forth and recap what happened in the day. Emotional support, that includes, different techniques, anxiety reducing techniques, self-calming objects, whether that's fidget spinners, breaks to take away and step away from the space. Just really encourage that open door policy with the social worker and with the teachers. So you can bring those ideas to them. Say, hey, this is working really well at home. How about we implement something similar to this? What could that look like at the school? As we've talked about, memory is really something that a lot of students struggle with. So sometimes there needs to be a buddy system or maybe small work groups. Maybe it does need to be a parapro or aid. We really, again, want to just support those students and build that self-esteem and socialization skills along with doing their education. Other support services, again, if you have the opportunity to give advance notice for planned substitutes being out, this is something that is very helpful for specific students who maybe struggle with routines. That's something you can request. If you know that your teachers are going to be out for an extended period of time or on different days, just let the students know. That's okay. Every student's needs are different, and this is just catering to that request. Again, ensuring that everybody has all of the information, the seizure action plan, 504, IEP, they understand it clearly. expectations are written down and given, and provide the student with a signal if they're unable to clearly communicate their needs without interrupting or causing a scene in class. So sometimes a student just needs to walk out because they're just not feeling well or that type of thing. Now we want to use caution because we don't want the student to leave the classroom and have a seizure. But if we know that there's a need, like they're getting overstimulated, maybe there's a sign that the student shows the teacher, and the student can, or the teacher can kind of reassess the class and make that a different transition. Let the student share their story if they desire to. This is huge and it's so impactful. In fact, we're having our Wellness and Epilepsy Conference coming up here soon. And we have 3 teenagers sharing their stories about epilepsy and what that looked like in schools, what that looked like in extracurricular activities. Sharing your story has so much value. Encourage your student to share their story. I will say that we're not going to force them, because there are times in a student's journey that's not of interest to them. Especially we see that in junior high and high school students. But if we start them out young, sometimes they're open to that. And another way, and I'll tell you this from personal experience for my daughter, when she stepped back from that, she was in high school and then she had the opportunity to volunteer. Well, what better place to volunteer is with the Epilepsy Foundation of Michigan, because you find your community, you find your voice, you find your people. Huge changing moment for so many young adults now, because that's what they did. They got involved. So we would always encourage that. Sometimes we need to limit our activities, right? If it's a presentation or reading aloud, sometimes we need to rethink how that's offered or extend different options to a student. Again, we've talked about some of these, providing extra test time, maybe even a little different location, and adding those supports as needed, encouraging those brain breaks, talk through behavior problems and monitor the student's emotional state and a frustration one-on-one. So if you see the student struggling, there could be another underlying factor. So open communication with the family is very important. So really the goal to treatment is early intervention, right? Sometimes we don't always have that choice, but this helps improve coping. It prevents and reduces future difficulties, such as a loss of friendship, failure to reach social and academic potential, and feeling of low self-esteem. So evaluations from qualified mental health professionals are very much something that's a conversation in the world of neurology, because we want to make sure students' mind and wellness is safe. Different medications, there's different medications that decrease the seizure threshold. So we want to think about those. Again, back to school supports, there's different things to, again, remember and think about quite often. We talk about them a lot just because we don't want you to forget them. You know, they say that adult learner has to hear it a few times. So additional supports to consider too for your student, maybe even outside the school setting or some within. Therapy and counseling is always a great consideration. A student who's going through medical challenges in any shape or form could benefit from this. We actually have a list of therapists who have been trained in seizures and epilepsy. They have an extensive background on the understanding of what comes with that. We're always here to support you and share that with you if you're looking for a therapist or counselor. There's cognitive behavioral therapy, which is extremely beneficial for people with epilepsy. We have students, Camp for Students with Epilepsy. This is one of my greatest joys of the year. I get the pleasure of leading that camp, actually. And this is a free to little cost camp that's designed for students with epilepsy. There's psychoeducational and support groups. We have many support groups. We have a group called eSmart. It's one of our self-management programs for teens around advocacy and resilience. There's case management available through CMH or Children's Special Healthcare Services. There's a lot of supports in there for you too. Reach out. You deserve the support, and it is there and available. There's different behavioral health therapies, play therapy or art therapy. Those are also good additionals, supports. And then there's also, you think about the supports offered through IDEA or your 504, right? School social work, behavior management, OT, PT, speech, those types of things. And then you have a lot of fabulous agencies within Michigan. We have Michigan Alliance for Families, the foundation here. 211 is a great help too. If you just dial 2111, they'll give you some really great resources and point you into the right direction. So just know you're not alone in this journey. There's a lot of support and people who want to care for you. So lastly, we're just going to follow up with inclusion. When I talk about inclusion, this is one of my favorite things to talk about because I've seen the impact. Including your students in their story. This is their story. Let them speak on their behalf. Let them share what they want, how they'd like to see things done. Again, when it comes to the school, we want to make sure there's no mimicking or posting of a person during a seizure because everybody has a cell phone on them now. We want to be constantly intervening. We want to bring education to the classroom, right? What does that look like? Does that mean we have an assembly and it's Purple Day, right? We talk about brain health and seizures and epilepsy and all the other neurological disorders, things that we can bring inclusion by doing a fundraiser where everybody wears purple and donates $1, or we come into the school and do some sort of assembly. You'll see there on the page, we have this huge blow up brain that you can walk through and learn about the brain and brain health options. And we have a really great program. There's so many ways that students can be involved. There are a lot of actual opportunities for students to be involved in volunteering, especially as a family. We have our strolls, incredible experiences all over Michigan for families to get involved and share their story, not only with their families, but outside of their families. This is a perfect opportunity. Recently, we saw last year a student invite their entire class to join them for their summer stroll for epilepsy, and everybody had group shirts, and it was beautiful because it encourages that peer support. Support and abilities campaign. I went to a school recently and I thought this was the most amazing thing. Their PTA ran abilities campaign where they talked about different abilities and disabilities. Every week they chose a different disability or ability. So you might have something like epilepsy one week, and then other differences different weeks, and we talk about those and celebrate those, and we make that a thing. We make that a real pliable, like, these are the people living in our community, and this is what makes us also unique and special. Again, Purple Day is in March. November is Epilepsy Awareness Month. Perfect opportunities to be involved, to bring your school staff around alongside of you. And parents, this is something that you can initiate. You can walk in and say, listen, I have this idea. How can I make it come to life? Join your PTAs. I'll tell you, the PTA, I wish I would have known this when my kids were younger. PTA is for everybody, and they are doing some amazing work. They are actually one of our huge champions for the Seizure Safe Schools Act, and they are helping us get this bill pushed into motion. It's because they care about students, and I would encourage you, if you have the space and time and it sounds fun, get involved. The more you can be involved and more present, the more open conversation there is. I have a lot of resources available to you. This is to anybody living in Michigan and beyond, whether you are a parent, a person with epilepsy, a family member with epilepsy. We have a lot of great resources. All of trainings and pages like this. We have conferences that in person. You can do it live over Zoom. You can do that on demand through our learning portal. We have videos and pamphlets and flyers and posters that you can print off and share. So please just know our website is a great resource. On that website, you'll find an About Us page. That's where you'll find me. If you have something that you need to reach out on, or you have a question, feel free to reach out to anybody through the foundation. We have an 800 number that is always available to you. It's a toll-free line, our Here For You helpline. Anybody who calls that, we're going to respond to them and be able to help walk you through or guide you to what you need, whether that's a listening ear or different supports and services. Another thing I'll just mention, I already mentioned Camp for students with epilepsy, but we have our Teen Smart program. That is an incredible group. We also have a teen call group that happens monthly, or I think bi-weekly. Yeah, actually, great opportunity for students to be with people who are walking through the same journey. My daughter was 15 or 16 before she actually met somebody else with epilepsy and actually witnessed somebody have a seizure. That was really eye-opening for her and empowering. So again, we have a lot of information available to you, whether it's treatment options, making sure you're at the right physician's office with the right medications, lots of information available to you, but please reach out to us for that. Again, my name is Shannon Waid. I am the epilepsy education outreach person here at the foundation. I have a pleasure of getting to serve you. All of our contact information is here. It's you're welcome to use that. Keep it for later. You can always find us online. But it has been such a pleasure today sharing with you. I just hope that you continue in your student success and have a great conversation with your school. And if you come up against those barriers, reach out to somebody. Just reach out to somebody. You're not alone in this, and we're here to support you. So thank you so much and have a wonderful day.
Michigan Alliance for Families is also here to support you. We are active on Facebook, Instagram. Check out other videos on the YouTube library. Remember, your parent mentors are there for your specific questions, 800-552-4821. Looking for a quick email question, info@michiganallianceforfamilies.org. Thank you so much for tuning in today. We hope this information was useful. We look forward to learning with you in the future. Michigan Alliance for Families is an IDEA grant-funded initiative of the Michigan Department of Education, Office of Special Education, and Michigan's Federal Parent Training and Information Center, funded by the U.S. Department of Education, Office of Special Education Programs. Thanks for tuning in. Have a great day.